Can you tell us who you are and what your connection with Parkinson's is?
Yeah. So I'm Spencer, but right now I'm a data engineer at a nonprofit pharmaceutical company, and my tie to Parkinson's is my dad's diagnosis, and that's the whole reason that I've ended up building this Parkinson's pathway application. So yeah, he was diagnosed in 2021. Luckily, it's a slow moving or slow progressing case for him.
How did you kind of get the motivation to create what you're creating now?
Really, just a lot of conversations with my dad. I mean, I built it for him. Like it's just kind of came out of conversations with him during his trial and try his journey and trying to find a trial. Um, and he was exploring like clinicaltrials.gov. He was talking with his neurologist. He was doing all the things that you should. And then we were still talking. He was like, it's just there's so much and it's so hard. Like it's so geared towards researchers and um, people with like a science background, and it's hard to understand. So he was just like, if there was it feels like there should be a way for like people like me or other patients or anybody, their families, their caregivers to understand like what's going on out there, what regardless of if they're trying to enroll, at least to be able to see, oh, there's all of this stuff going on in the research world that maybe somebody will benefit somewhere. So yeah, I built it for him so that he could have an easier way to explore them. So it ended up being just a platform that simplifies the trials. And just stepping back a little bit, that's like the summaries of the clinical trial. So who's sponsoring the trial? What are they testing? Is it a drug that was maybe used to treat diabetes in the past and now they're trying to apply it to Parkinson's? Um, Instead of like all of these, oh, we're doing, I don't even know, whatever like the fancy drug names and compound names would be for these different things, just putting it into words that like I can understand. Um, and so this platform lets people explore those trials that are out there and lets their families explore them. And even recently added like a just a super simple matching feature, like how far along in your Parkinson's, how much has it progressed, what stage is it at, and age, just some simple eligibility criteria that can sometimes be hidden within the trials. So yeah, just a comprehensive like here's an easy way, an approachable way to explore these trials that um, different sponsors are putting on.
Okay, so what I'm understanding, and you feel free to correct me. So what I'm
Mhm.
understanding is through this resource, you filter out research, current clinical research for Parkinson's. You make it accessible, like you
Mhm.
said, for people to actually understand what the research is looking at and what it entails, and then just kind of provides a more simplified way of accessing it and then signing up for those things.
Yes, yeah, exactly. Um, and even just like opening the door to us to have feel like somebody could have the conversations with their neurologist and just be a little more prepared and um, ready to kind of explore like what's out there. But yeah, that's exactly right.
Was there like a certain experience where you kind of you mentioned, with seeing your dad kind of navigate Parkinson's,
Mhm.
was there a moment where you saw um, that difficulty in real time? Like, was it somewhere where he was talking with a neurologist? Was it him like on the internet on clinicaltrials.gov?
Mhm.
What kind of triggered that for you?
Yeah, it was you nailed it. It was his exploration on clinicaltrials.gov, and all of a sudden he's sending me like research papers and different trials, and I'm like, I don't know. I haven't read a science paper in like years. Um, but and he's like sending me all this different research that's going on, and he's like, it's just so much to like wrap your head around. And I was like, I don't know what's going on, but this looks cool. This looks right. And it was like just a lot of those little conversations, and him sending me things and talking about what he's discussed with his neurologist. That was like he just wanted an easier way and like to understand everything instead of sifting through these papers, sifting through all of these different trial listings. And yeah, this was my way of hopefully like opening that door, just making it approachable that there are these things going on. But yeah, it was all those little conversations along the way of him trying to find a trial to enroll in.
Mm. And you mentioned also that there's a feature with this resource that you can kind of filter out, how long you've been diagnosed with Parkinson's, whether
Mhm.
it applies for you. Can you tell us a little bit more about that?
Yeah, and this is a relatively newer one, and I wanted to keep it a little tighter than like some other like the Fox Foundation has the great like the Fox Trial Finder tool that's super detailed, super in depth. Um, and this is just a little bit more if somebody's just gotten diagnosed and their family's just found out, like it's overwhelming. It's a lot to deal with just the diagnosis itself. So my hope with the tool was that this would be a starting point. So this matching tool that or feature that I put into it is just a simple like 4 question, what's your location, what's your progression, what's your age, a lot of the high level criteria that all the trials look for, so that then you can get back a list of like 10 to 20 trials that, okay, this might be a starting point to talk about these trials with my neurologist, with my family, or just hey, at least they're working on stuff that might end up working for me down the line.
Yeah, and then you touch on like such a big pain point for people with Parkinson's is the overwhelm of all of the resources. There's a ton of excellent information out there. You mentioned Michael J. Fox Foundation, but when someone gets diagnosed, it's like, okay, now I'm going to do my research, and I
Yeah.
come back with so much that you're not really sure where it applies, what the best place to start is. And I'm hearing that this kind of just helps like condense all of the options to like here's maybe where your first step could be in the direction that you need.
Yeah, yeah, exactly. And hopefully like giving giving people a sense of hope that like things are being done. It's not there's a lot of work in the space, a lot of work to find a cure, to slow the progression, to treat the symptoms. Like there's so much going on, and hopefully this resource at the very least provides like some hope for people who have just been diagnosed and their families, that their caregivers, whoever it might be.
Yeah, that's awesome. Where can people find this, and what's the best way to kind of get on board and access the resource?
Yeah. So we've got an Instagram account, Parkinson's Pathways, and on the website, parkinsonspathways.com, we've got you can sign up for a newsletter. You can just explore the trials. If you do explore it, you can message us on the Instagram account, email me at spencer@parkinsonspathways.com, and I love hearing from everybody, feedback about the site or just stories, anything. It's just great to talk with people in the Parkinson's community. Hope to continue growing and reaching as many people as possible. Um, Maybe one day we'll touch on like some other diseases or neurological conditions, but for now, just extremely focused on the Parkinson's community and really tailoring it and making it as beneficial as possible to them. Yeah, I know I already said this, but really just providing hope to people who have just been diagnosed and their families, because that's it is, like you said, it's just so overwhelming at first. So hopefully this is a beneficial resource to anybody who's starting the journey. Yeah, there's so much to it. And I've started to try to also like put out some articles on the site just to add like what are the phases, what is a trial, like I don't
Yeah.
just all the stuff that like me and my dad would run into and our family would talk about at first. It's like we don't know what any of this
Yeah,
any of
like
this
what are
stuff
the
means.
phases
And
of clinical trials, Like what
yeah,
does that mean?
yeah, yeah,
The positive end to the overwhelm is that there is something
yeah.
probably for everyone if you can find it.
Yes, that's the yeah. If you can find it,
Right.
that's the key.
So, but anyway, I appreciate you taking the time to answer these questions.
Thank you so much for taking the time.
Thanks, Spencer. Have a good rest of your day.
You do the same.